Taking action on back pain is the most essential decision you're gonna make this year. A lot of people are dealing with back pain for so long that it becomes a surgical case and it's just inevitable. So today we're gonna go through 4 movements that you're either gonna get 90% improvement or you're gonna become a surgical case. So let's go ahead and take care of it today and get you relief. Number 1, first thing we need to do is a glute rollout. We need to loosen up these glute muscles. So what I'm gonna do, it's best to do on the ground, but you could do it on a bed. You just wanna put maybe a towel or a yoga mat underneath you. You want it to get a little bit stiff. I wanna start hook lying with my knees bent right here. I'm gonna put this off to the side. It's gonna be in between where my hip bone is and where my pelvis is. So right around my belt loop. Right here, and then I'm just gonna roll over to the side. I wanna loosen up the gluteus medius, maximus, and the minimus. They're all overlapping in this area, and if I loosen that up, then it's like a corkscrew. I'm releasing I'm detensioning muscles that are pulling on my back all the time. So I'm loosening that up. I'm also allowing my hip to move around without pulling my low back. So I'm gonna rest right here. So I keep my Superman emblem, my belt buckle stays stacked, and I just lay into it. I'm at a 45-degree angle. If you want to move around, we can just wiggle this leg. That's all we need to do. So we're going to do 1 minute on each side. I'm going to set up on the other side. So same thing, I'm just going to show you one more time. Right here, belt loop area. Don't lift up and slide under. I want to be off to the side, and then I want to roll into it, making sure I'm doing that, and then I'm going to stabilize and rest my head. I don't want to be up like this. It's another thing that people do. Well, I'm twisting up my low back when I'm laying like this. I want to lay down in a neutral position, just roll into it. I can wiggle this leg. I do 1 minute on each side. That's the first thing we have to do, is loosen up that tissue, and then we'll activate it and we'll work on our movement pattern. Number 2 is side steps. I'm activating my glutes while I'm keeping my core in a neutral position. So what I'm gonna do is put this just above the knees. And so I'm gonna scoot back just a little bit. And so I wanna kick my butt back into here. So you're just gonna see I'm coming back like this. My butt is engaged in this position, and I'm doing side steps, 1-inch little steps. So I think it'd be best if I just move this out of the way. You can see my feet right here. So I'm hip hinged and I'm sidestepping 1-inch little steps. This is gonna be a very efficient way to fire up your glutes where you're not dealing with too much range of motion. When you do this, we start twisting up in our low back. We're not using our glutes. We're twisting up in our knees. We're twisting up in our low back. We're not engaging our glutes the way that we need to. We need to make sure we're taking 1-inch little steps. So I want to be here, just keep my back in a neutral position, and then I'm 1-inch little side steps. Everybody that I see that does this wrong, they just take too big of steps. They're not engaging the glutes, which is the whole objective of the exercise. We want to engage the glutes, but we don't want our back and our pelvis moving around a ton. So that's number 2, is making sure we're doing side steps. I'm going to do 10 1-inch little steps going one way, 10 1-inch little steps going the other way, and I'm going to do 2 sets. Now let's get into number 3. Number 3, we're gonna need the table again. So I'm gonna bring it back out right here. Magic. Okay, so what I'm gonna do is a bird dog. This is another exercise that's done incorrectly or not optimally a lot of times. I wanna be knees underneath my hips, and I want my hands underneath my shoulders right here. I'm gonna separate out outside my hips, and I'm gonna tighten in my tummy. And then now I'm gonna separate and do my arms first and then my legs. I'm not gonna do them at the same time because people end up doing back extension, me included. So think about, you got a laser pointer in your belly button. It's pointing right here. I wanna keep it directly pointing in the same spot. So I'm gonna lift my arm up, controlling my breath, and slowly shift over. It becomes significantly harder when you do it this way. And I'm gonna do 5 with each arm staying right in the middle. If I do this or just drop my back at all, then it's incorrect. I gotta stay tight in my tummy and try to stay directly in the middle, not allowing myself to glide over at all. I do 5 with each arm, and I'm gonna do 2 sets of that. Now, do that for 2 weeks. And then you can gradually progress, and you can do your taps with your feet, which becomes harder. So the first progression is tapping with this leg, and I just tap my foot, and then stay in the middle and tap my foot. And then I'll do 2 sets of that, but we wanna stay for 2 weeks. That's a nice progression point, is 2 weeks with one exercise and then doing the progression after 2 weeks. When you have consistency, because we're building stability, we gotta make things harder. Let's get into number 4. Number 4 is a hip hinge. This is an essential movement, and it's the number one thing that we teach everybody. We have to be able to hip hinge. We gotta use our hips as our primary mover. So I'm gonna move this table back. You'll be able to see as I come right here, I typically measure up against the wall, so I measure my foot length away from the wall, and then I shift my hips back, I hip hinge, face stays in line with my chest, I push my hips forward, I push my hips back, push my hips forward, I push my hips back. You can see, I'm gonna do it up against the table right here. You can see that my back does not go into extension. I'm driving through my heels. My lower leg stays vertical. The couple things that I see people do, one is that they straighten their knees out, so they're continuing to load their back. So I don't want to do that. I want to come here, and then as I come forward, I get to a relaxed position. So that's axial load. Our spine's designed for that. So now I'm pushing back right here. What a lot of people do is as soon as they go to come back up, they'll push with their back leads it. Now we're leading with back extension, and that's what causes our back problems to begin with. So we don't want to do that. Now, number 3 that I see all the time is as soon as somebody goes down, they do this. They extend immediately. So that would be negative as well. So what I tell people is if they're having trouble with that, is to grab their belly, grab their belly skin, belly fat, grab it like this, dig your nails into it. And so if I extend, then it pulls, it's stretching, it hurts. So I'm grabbing tight and I push my butt back, and I almost end up parallel with the ground. And I push forward with my hips. So back with my hips, forward with my hips. I'm gonna do 2 sets of 15. I'm doing these exercises twice a day. I wanna make sure I'm consistent with this. The last one, that hip hinge, is a movement pattern change. And so we wanna get that ingrained. It takes about 320 to 360 repetitions to get nerves to fire together so that we can have a movement pattern. So I unconsciously grab something from the ground and I shift my hips back. When you start doing that, back pain is an afterthought. So let's make sure we're consistent with this program. Follow us for more videos on exactly how we fix things in the clinic, because we actually work with clients. We make sure everybody gets better when they come in. We wanna make sure you get the results at home. We'll see you in the next video.